Bismillahirrahmanirrahim. Assalamu alaikum. Dear colleagues and PGs, we are discussing pregnancy-specific liver diseases. Today is the 6th episode of this, and we shall discuss today the 5th case history. Till now, we discussed the normal physiological changes in the liver parameters in pregnancy. Then we discussed the first case history of hyperemesis gravidarum. Then we discussed the second case history of intrahepatic cholestasis of pregnancy. Then we discussed the pre-eclampsia and eclampsia. And in the last vlogs, we discussed the HELLP syndrome. Today, we are discussing the 5th case history. And then the one episode will be left of this series. That will be the 6th case history. So today, we shall discuss the 5th case history. History number 5. It's a case history of a 31 years old lady who is 33 weeks pregnant, and she was hospitalized for treatment of pre-eclampsia, suddenly developed right upper quadrant pain and shock. A 31 years old lady, 33 weeks pregnant, who was hospitalized for treatment of pre-eclampsia, she developed suddenly right upper quadrant pain and shock. On examination, BP 80/45. She was tender in the right hypochondrium with mild icterus. Liver functions: bilirubin 2.6, ALT 346, AST 270, alkaline phosphatase 210. So deranged liver function tests. CBC hemoglobin 8.8, platelets 76,000. Other labs: urea 60, creatinine 1.8, PTINR 2.7, D-dimers 170, urinary protein 77. So this is a case history number 5. 31 years old lady, 33 weeks pregnancy, admitted for eclampsia, and now she developed right upper quadrant pain, and these are the liver functions: BP low, tender right hypochondrium, mild ascites, and these parameters. So the question is, of course, what is the most probable diagnosis? So you write down the diagnosis with you, and let's see how we are, and how will you treat her. This is the case of hepatic hematoma and rupture. And this is again, as this is a complication of pre-eclampsia and eclampsia and HELLP syndrome. This happens in the 2nd to 3rd trimester and maybe the early postpartum. So this is the case number 5th. We have discussed till now hyperemesis gravidarum, intrahepatic cholestasis, pregnancy, pre-eclampsia, HELLP syndrome, and now this is the hepatic hematoma and rupture. Few words about hepatic hematoma and rupture. Causes of the hepatic rupture: these are the HELLP syndrome, pre-eclampsia, acute fatty liver of pregnancy, cocaine abuse, neoplasms, sickle cell disease, polyarteritis nodosa, rupture of hepatic adenoma during pregnancy. So the HELLP syndrome, pre-eclampsia, acute fatty liver pregnancy, and the rupture of hepatic adenoma during pregnancy, these are the most common causes of hepatic hematoma and rupture in pregnancy. Imaging is required for the diagnosis, of course, the ultrasound. Intact hematomas are managed conservatively. But if the cause of rupture should be managed by team skilled in liver trauma. This is very important. After relative stability is achieved, angiography may be attempted. Surgical options include hepatic artery ligation, packing, or resection of the affected part of the liver. Hepatic hemorrhage or rupture carries a high risk of mortality for mother and fetus. We know that. So the hepatic hematoma or rupture, this is the end result of pre-eclampsia, eclampsia, and HELLP syndrome. Even it may happen because of the hepatic adenoma rupture during pregnancy. And once it is suspected, then of course you are prompt in the diagnosis. Like in this case, the patient was admitted for pre-eclampsia, then suddenly she developed, and of course the examination was suggestive of probably rupture. Ultrasound was done and it was found to be the hepatic rupture and hematoma. And then depending upon whether the hematoma is confined or it is ruptured outside the capsule, then according to that, of course, the treatment may be conservatively, or it may be after stabilization of the patient, you do the angiography, and you may involve the hepatobiliary surgeon in it, and the surgeon will be doing hepatic artery ligation, packing, or resection of the affected part. And of course, when there's a hemorrhage and a huge one, it carries a very high mortality risk for mother as well as for the fetus. So whenever a patient is admitted with you for HELLP syndrome or the eclampsia, pre-eclampsia, this complication must be kept in mind and the patient must be monitored for this. So in the next vlog, we shall be discussing the last case history of the series, and that will be the last vlog on the series as well. So I'll request you, if you have got any comments, if you have got any questions, please do share in the comment section, and I shall try to answer that. And it is open for our colleagues. They can share their experience into it. They can share their essentials, components of the management of pregnant ladies with pregnancy-specific liver diseases. In this series, I have tried to give you the salient features of the most common causes of liver derangement, deranged liver enzymes in pregnancy, and I have tried to classify them, to mention them according to the duration of pregnancy in the first trimester, in the second trimester, in the third trimester, because this is very important to clinically suspecting the disease at the right time, because the first step in the diagnosis of these cases is the threshold of suspecting any disease, and then of course proceeding and making the exact diagnosis. In the whole discussions, I have discussed with you the specific criteria of diagnosis, diagnostic criteria for each and every conditions, and the severity criteria, and of course the risk factors, that who are the patients who are at the risk factor of these pregnancy-specific liver diseases, and how to tackle them, how to manage them, how to prevent their recurrence, and how to monitor them for their impact on the pregnancy, on the mother, as well as on the fetus. So I end here. Inshallah, see you in the next and the last episode of this series. That will be case history number 6. Till then, take care. Khuda Hafiz.